ctDNA has got a number of different implications. So people talk about it in terms of stratifying tumors with so-called pTNMB staging, so pathological tumor node metastasis blood staging. They also talk about it in the context of predicting prognosis at a landmark time point where you might be able to up-titrate treatment and give additional chemotherapy if detection there. And then it's also relevant in the context of minimal residual disease during follow-up and predicting relapse prior to routine clinical surveillance. And what I think this study shows is that there's an important role preoperatively. So taking taking samples that were collected at the time of surgery and stratifying patients for treatment on that basis. And I think one setting where this could be particularly useful is stage 1 disease. So here, these tumors have typically quite a good prognosis, but we're not very good at predicting the minority of those tumors which will ultimately relapse and lead to death. And so what I think the real promise of this approach is, involves screening high-risk stage 1 tumors, and then in addition enabling us to de-escalate in the context of lower risk stage 1 patients. So in our cohort, the fact that 100% of ctDNA-negative stage 1 patients were alive after 5 years, that suggests to us that those patients definitely wouldn't have required adjuvant treatment and might even require less intense surveillance. Whereas on the other hand, stage 1 tumors where we detect ctDNA in the blood, or stage 2 tumors, etc., where the same is true, we can then look and say, okay, in that setting, we might want to escalate treatment and be more aggressive in the context of adjuvant options, for example.